Welcome to our monthly webinar, 955 days of continuous violence, and our people in Sudan are still suffering.
Broad destruction for essential health infrastructure, and also including the National Medical Supply Fund, pharmaceutical industries, hospitals, BHCs, and even the specialized medical center. More than 120 hospitals have damaged totally or partially. Health workers have faced violence, intimidation, and also forced displacement. The forced displacement of population of more than 12 million internally, and even externally we have refugees of more than 2 million.
Most of the burden is actually coming to the local communities. The nature of SAPA is locally led but globally supported. The aspects of the needs assessment, aspects of even strategizing our interventions are actually coming from the local communities on the ground.
If we look across South Africa, Rwanda, Afghanistan, Iraq, and at the same time South Sudan and Sudan, community has been the core. Not to wait to see the blood to give the first aid. We know dengue fever will be there. We know malaria is going to be there. How can we have the people with us and try to bring with us, even if they are displaced? Health security in any nation is regional and international security. It is time to put the people at the center.
Before we discuss the impact of war, it's important to remember that we had issues before the war. Our universal health coverage index was 44. There are multiple researches now published recently on the direct and indirect impact of war. The key message is that the global conflict events have nearly doubled.
A framework which has been tested, known, and practiced. And this is the Humanitarian Development Peace Nexus. What should be done and how can we do it?
Global response has been fragmented, slow, insufficient, leaving millions without the aid that they urgently needed. Affirm that EMPHNET remains fully keen and loyal to supporting Sudan public health needs through operational engagement, technical assistance, capacity building.
Peace is coming. It is coming. It is on the horizon.